Healthcare workers across the country are feeling burned out. Some in Central Oregon are even moving off the front lines. Noah Chast spoke with one nurse about why working during this pandemic has pushed some away.
At the start of the pandemic, healthcare workers were honored and recognized for their hard work. But for some, the constant stress outweighs the public praise.
I think what I've seen is people wanting to just do something different.
Tiffany Simmons is a nurse with St. Charles Health and a member of the Oregon Nurse Association, or ONA. She says she knows at least 10 people working on the front lines who have switched to consulting, case management, or educational positions. Simmons calls the stress she's faced this past year a slow burn. She says even before the pandemic, there was the stress of working with sometimes aggressive or difficult patients. Then early in the pandemic, there was the fear of dying every day she went to work. Now, almost a year later, the pandemic is more commonplace, but the stress continues.
Challenging in regular times, and then you throw something that has the potential to be fatal on top of it, and working under those conditions, it's a lot.
Kevin Mealy with the ONA says there are enough Oregon nurses in number, but it takes time to fill open positions.
We haven't actually caught back up. There are people who have left the profession at the start of the pandemic who haven't been able to get back.
Simmons still goes to work every day, but the thought of leaving has crossed her mind.
I'll be transparent with you. I have absolutely considered doing something else and stepping away from the intense day-to-day bedside 12-hour shift work.
After a year with this pandemic, with all the stress, why have you stayed?
Gosh. Ultimately, I love what I do.
In Bend, Noah Chast, News Channel 21.